Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. The rise in unemployment and economic recession from COVID-19 means more Californians will depend on state-funded health coverage, including Medi-Cal and Covered California. Yet a state budget deficit may be forcing cuts to these very programs. What are some solutions? I am very excited to be joined by Lupe Alonzo-Diaz, president of the Physicians for Healthy California. Lupe has a long history as a patient advocate and administrator of workforce programs, and I'm proud to have partnered with Lupe on child advocacy as a pediatrician before entering the legislature. Thank you so much for joining me, Lupe.
Thank you, Dr. Pan. It's an honor to be here.
Thank you. So tell me, what is this Physicians for a Healthy California?
Thank you. Physicians for Healthy California, otherwise or lovingly known as PHC, we're a nonprofit that was founded in 1963. Our core mission is to promote health equity, community health, and the diversity in the physician workforce. We're also formerly known as the California Medical Association Foundation. We believe we're good partners to good government, and so we work very closely with state government, with public funds in order to support everyone's increased access to health.
Okay. And what are some of the programs that Physicians for a Healthy California is conducting right now?
So there's three of our larger programs include the Network of Ethnic Physician Organizations, otherwise known as NEPO, and NEPO is responsible for, on an annual basis, joining a number of diverse physicians as well as physicians that serve in underrepresented and underserved communities to convene and identify best practices for supporting and addressing health disparities. We also work on, we administer two very specific programs that are supported by Proposition 56. One is supports the Physician Workforce Pipeline Program, and the second one incentivizes increased access to care in underserved communities, and particularly with Medi-Cal beneficiaries.
Okay. So you mentioned Prop 56. And in fact, in 2016, the voters passed Prop 56 to increase tobacco taxes to fund increased programs to improve access for patients on Medi-Cal. So what did Prop 56 back in 2016 promise to voters?
The promise to voters was that we would work collectively together towards a goal where all Californians, regardless of their income and regardless of the insurance that they have or may have, that they would have access to physician services, either primary care or specialist, when they needed. And very specifically, Prop 56 works this way. It increases the price of tobacco products to reduce their use and the health risks that are associated with these deadly products, particularly amongst teens and younger people. And then it also uses these funds to expand access to essential health care by investing in the state's Medi-Cal program, which ensures more than half of California's children and more than a third of California residents.
Now, I know being in the legislature, one of the things that we've struggled with the Medi-Cal program was actually low payment rates for doctors, dentists, other providers, which in fact were cut during the Great Recession as well. And I know that when we went out to talk about Prop 56 to the voters, we talked about both the need to reduce tobacco use, particularly among our youth, to discourage that by increasing the cost of these tobacco products through the tax, but also to help support better payments for physicians, dentists, other health providers so that they would be willing to accept more Medi-Cal patients. But in addition to that, I know that there are other programs as well that came out of this goal to try to improve access for patients on Medi-Cal. So, and you referred to two of them that your foundation's working on. So can you talk maybe a little more at length about how Prop 56 funds are being used to improve access right now?
Definitely, and thank you. And you're absolutely right that it's In terms of accessing and increasing access to care and health disparities and ensuring that that access is there for those underserved communities, Prop 56 has been very forward-thinking about how that's done. First and foremost, as you mentioned, it does provide enhanced payments for Medi-Cal providers, physicians, dentists. It also focuses on women's health, family planning, developmental screenings, et cetera. And then, as you noted, Prop 56 does ensure that physicians address that growing health disparity in those communities, particularly in communities of color, particularly as we think about, this twofold crisis. It's economic, it's also a public health crisis. And in addition to that, there's the background of having a physician shortage. And the shortage is both the numbers in terms of having an adequate number of providers, as well as geographic distribution and diversity. So on that note, there are two very specific programs that Physicians for a Healthy California oversees, and these investments are working. The first one is called Cal MedForce, and it is a program supported and funded by Prop 56, and it sustains, retains, and expands graduate medical education, basically residency programs. And this is important because it supports the physician pipeline workforce. It supports those programs, those residency programs that train and expose their physician residents in underserved communities. So we focus on those residency and training programs that are walking the walk, and they are increasing access to care in those communities. They are increasing their clinical rotations in underserved communities, like perhaps a homeless clinic or a migrant farm worker clinic. And what we know and what the data shows us is that physicians tend to practice where they train. In the last two cycles, in our two inaugural cycles for Cal MedForce, we've had requests for more than $240 million from various residency programs across the state, and we've been able to award more than $76 million. That has resulted in support for 354 residency positions, and 114 of those 354 are new residency positions that likely would not have been there and could not have been supported without Cal MedForce, without the pipeline program. The second program is called Cal Health Cares. And this program very specifically recruits and retains physicians and dentists in terms of providing support, recruitment, and retention in those underserved communities. And it specifically targets young physicians and dentists so that it may support their long-term commitment to practice with Medi-Cal beneficiaries. And just as an anecdote, in our first inaugural cycle, which was last year, we had more than 1,000 physicians and dentists that applied, and their total educational debt load was over $500 million. And in our first cycle, we only had, we had about $67 million to award, but the educational debt load of these physicians and dentists, young physicians and dentists that wanted to make a commitment and practice with Medi-Cal beneficiaries was over $500 million. And their average debt was $396,000. And for a lot of Californians, that's insurmountable. It's unfathomable. It oftentimes can be larger than a person's mortgage. So certainly the Cal Health Cares program is a very important, significant investment in terms of recruiting and retaining physicians and dentists to practice, in underserved communities, but, really with those Medi-Cal beneficiaries.
And in fact, I understand that the loan repayment program expects these physicians and dentists to see, I think, at least above 30% of Medi-Cal, but they're actually seeing what percentage of Medi-Cal are they seeing?
Yes. So with the Cal Health Cares program, there is a minimum requirement that physicians and dentists have a minimum of 30% of their patient caseload that is Medi-Cal. And in our inaugural cycle, the average was 63%. So our average for our awardees that were awarded a loan repayment program was 63%. We monitor our awardees to ensure that they are meeting their caseload obligations. And what we've seen in the last, in their first 6 months of their award, is that they've actually increased their Medi-Cal patient caseload even more so than they had committed to. So I think this is a really good reminder that that in order to ensure that Medi-Cal beneficiaries have access to healthcare services, it starts with ensuring that we're addressing the physician shortage.
Oh, that's fantastic. In fact, actually, with the coronavirus pandemic, we are seeing more people, unfortunately, lose their jobs, which means they are now enrolled in the Medi-Cal program. And in fact, the state is projecting an additional 2 million Californians enrolling into Medi-Cal, in addition to the people already on Medi-Cal. So, and you kind of maybe perhaps sort of answered this question already, but how are Prop 56 and Physicians for Healthy California going to help assure that these 2 million new enrollees in the Medi-Cal program are going to be able to find a doctor to take care of them?
Well, much depends on the budget, as you noted, that will be passed in the next couple of weeks. And certainly, as you know, in your leadership position, the Governor Newsom and the legislature have taken very different approaches to health care in their budget proposals. We also know that the governor has noted time and time again that the budget is a reflection of our values. We believe the legislative approach is a responsible way to ensure we continue to invest in our Medi-Cal program. As you noted, it's anticipated that there will be an increase of 2 million additional individuals that would qualify for Medi-Cal. We're in the middle of an unprecedented economic and health crisis, and we need to ensure our safety net is strong enough, and that it be strong enough today and to carry us through this time. Because we're still in the middle of this pandemic, now would not be the time to make cuts to critical programs like Medi-Cal. So via Prop 56 and via the programs that PHC, that Physicians for a Healthy California, administers, we would be at the front lines in terms of supporting and ensuring that there is that increased access, whether it is the recruitment and retention through loan repayment programs or whether it is continuing to build on that physician pipeline.
Well, certainly the legislature will be passing a budget for next year on June 15th, and then the governor will have until the end of June to sign it, and that budget will take effect on July 1st. But I also note that given the uncertainties related to both the coronavirus pandemic and the delay in income tax filings until July 15th because of the coronavirus, there are probably going to be additional adjustments made to the budget. But I think, as you pointed out, the demand for state services like Medi-Cal actually goes up when the economy goes down and tax revenues are down. And I think that's part of the challenge we're trying to balance out in the legislature regarding the budget. But certainly Prop 56 was to help fund this improved access, and the programs that Physicians for a Healthy California are administering are certainly very important to being sure we have the workforce available to see the patients as we're enrolling more patients in the Medi-Cal program. Now, one of the things, though, as we're talking about the economic downturn, it's not just the budget. In fact, the California Healthcare Foundation did a survey of primary care physicians in the state last month, which showed one-third of primary care physicians are worried that their practices and clinics will be forced to close because of the economic impact of COVID-19. We've seen a tremendous drop in visits to their practices. What should the state do to ensure patients will still have access to doctors during and after the pandemic? So we're not just talking about Medi-Cal now. We're talking about everybody in the state if we're going to lose potentially up to a third of our primary care physicians.
That's a very good question, and there are a number of proposals that are being put forward to ensure that insurer-provider networks are maintained and that those primary care physicians are able to keep their doors open during this crisis, as you mentioned. And it is something that impacts, as you mentioned, not just Medi-Cal beneficiaries, but all Californians. And we're concerned about that long-term impact of the COVID crisis and what that would mean in terms of the viability of physician practices and generally the future of our healthcare infrastructure. We should be wary of increased consolidation that could come if physician practices continue to struggle. And we know that over the long term, healthcare consolidation is not good for patients. It can drive up prices and decrease access to care.
Well, certainly we have a lot of work to do, and the state is a major payer for healthcare, but of course we also have our businesses and individuals paying quite a bit into healthcare, and this is a public health crisis, so we know that we need to expand that access to healthcare to be sure people are able to get care for coronavirus. We don't want people who are sick not unable to get care and then potentially passing the disease on to other people as well. So there's certainly a lot of work to be done. So you're head of this foundation, you're president of the Physicians for a Healthy California, but you're also a longtime patient advocate. To you, what are some of the budget priorities that are most important to helping all Californians get health care during this pandemic?
For me, it's personal. To having come from a very traditional family and, just having for myself as a child, being a beneficiary of Medi-Cal and of others, social services to support my family in their time of need, I certainly recognize and stand with everyone else who acknowledges that our budget has to be a statement of our values. And these are difficult times. These are unprecedented economic times. But it's in these moments when we have to remember our true north. We have to remember that we must protect our social safety net. We must protect those vulnerable Californians. That includes Medi-Cal, to ensure that we're helping the people of our state to help our residents get through these really tough economic times. We know that the governor and our legislative leaders like yourself, and we really value your leadership, Dr. Pan. We know that there's shared core values, and that those core values reflect that we need to protect the most vulnerable amongst us, and providing access to care for everyone is part of that. As I noted earlier, we are in the middle of a global pandemic. This isn't the time to cut healthcare services, and I'm hopeful, I'm confident that the legislature and the governor will come to an agreement that really reflects our core values, our true north.
No, thank you so very much. And, we have worked to try to prepare for an economic downturn. The state actually has had record reserves in our state budget, including a safety net reserve. Obviously, we were not able to anticipate an economic downturn of this magnitude or a global pandemic, although I think many of us in public health were worried that a global pandemic would occur at some point in time, but certainly didn't have a specific date certain that we expected it to happen. So we've tried to prepare, but at the same time, this is, I think, so many families in California are personally experiencing the impact of this pandemic on whether it's their jobs or businesses, so many other issues. And while some people may have been doing well before, there are so many people who are not doing so well who now are being affected by the pandemic on top of this. So there is certainly a lot of work to do, and I think that we would need to be sure that people get access to care. I mean, that's at the root of the pandemic, right? This is a infection. This is a public health crisis, but this is also a crisis where when people don't get care, that's not only about them, it's about how healthy the rest of us are as well. And certainly we want to take care of each individual Californian as well. So, I mean, we do care about each individual person's health, but we also need to realize that health is going to impact all of our health. So if that isn't enough for us to step forward, I'm not sure what else I need to say, but I know you had some thoughts about that.
Yeah, as you noted, we've worked together for a long time, and we, share very much the same core values of, just investing in our most vulnerable of Californians. Again, I noted, just for me, it's personal, because it's not just about the data and the statistics, although those numbers definitely bear in mind, but there's real people behind those numbers, and there are individuals that were already not doing well before this economic crisis, that were already challenged with access to care. They were already challenged with having stable employment, and with this global pandemic as well as the economic crisis, for a lot of vulnerable Californians, it's just, it could have put them over the edge. So now I certainly appreciate the leadership, Dr. Pan, that you bring to this conversation, both as a physician and as a leader, and particularly as a pediatrician, who just shares in the values of ensuring that we're investing in California, and that we're making decisions not just based on the basis of today, but on the future and what the future can hold for us. And that means that we have to continue supporting those safety net programs like Medi-Cal that ensure access to health. And as you know, and as has been noted elsewhere, that access to care for that child, for that Californian, but particularly for children, it can have developmental effects if they don't have access to proper screenings, if they don't have access to child visits, et cetera. So certainly this is one where, we must ensure that we're holding the line in terms of protecting vulnerable Californians and protecting their safety net, protecting our safety net.
Well, thank you so much, very much, Lupe, for joining me today, and thank you so much for your leadership and advocacy.
Thank you, and it was such an honor to talk to you today, so thank you.
Right. Well, thank you. And thank you for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wash your hands frequently and try not to touch your face. Together, we are slowing the spread of the disease and saving lives. Thank you so much for listening.